nurse who may be a family member, a significant other, or even just a friend that you feel that isn't talking to you as much as normal? Maybe had an argument or they just won't pick up the phone. I have a resolution for you. Tell that nurse that you have a cold and you just started antibiotics. They will respond. They can't help themselves. Many people do not utilize their antibiotics like they are prescribed to be used. Oftentimes, people will go to the doctor demanding an antibiotic for a common cold that isn't even a bacterial infection, and some will only use medication for a few days until they start to feel better. Improper use of antibiotic therapy is a harmful and sometimes fatal situation that can cause themselves and the generations to come harm. More and more frequently, there are what scientists have dubbed superbugs that are occurring often, and because of the improper usage of antibiotics, these superbugs are growing stronger and stronger, becoming resistant or unaffected to even the strongest antibiotics that are available today. I've been a licensed practical nurse since 2012. I've worked in a hospital setting my entire career, and it is amazing to see the difference of how aggressive these superbugs have become. When I first started my career, I can remember getting a patient that had vancomycin-resistant enterococcus, or VRE. Everyone was nervous to take this patient. I mean, if this infection can't even be cured by one of the strongest antibiotics on the market, how are we going to be able to treat this and be safe about it? Fast forward to 2019, and I can't even begin to tell you the number of patients that are hospitalized on a normal day for VRE and other superbugs that I will later discuss. Today I would like to talk about 4 things that are crucial to remember when it comes to properly using antibiotics. First is, when do you need an antibiotic? Secondly, the superbugs that are increasing in strength, making it much harder to fight this type of infection off. Thirdly, how to properly take your antibiotics. And lastly, how we can cut back on the usage of antibiotics. According to an article online from the Center for Disease Control and Prevention, or CDC for short, antibiotic resistance is one of the most urgent threats to public health. Antibiotic resistance occurs when bacteria develop the ability to defeat the drugs designed to kill them. More than 2.8 antibiotic resistant infections occur in the United States each year, and more than 35,000 die as a result. The CDC also states that about 30%, or 47 million, antibiotic prescriptions are prescribed unnecessarily in doctors' offices. Many times, people develop a viral cold, making them not feel well and resulting by going to the doctor and demanding an antibiotic. If people knew when antibiotics were actually needed, the increase in antibiotic resistance would go down. Per the CDC website, here are some of the times when antibiotics are needed. Antibiotics are needed for treating certain bacterial infections, not just a common cold that is usually viral. Antibiotics are treated when life-threatening infections arise, such as pneumonia and sepsis, which is the body's extreme reaction to fighting off these infections. Antibiotics are also used as a preventative source for someone who may be undergoing surgery, or a patient that has end-stage kidney disease, or they have an autoimmune disorder or are immunosuppressed altogether. The CDC has also stated that antibiotics do not work on viruses such as cold, the flu, bronchitis, or runny noses. And yes, that means even if your snot is green, you do not need an antibiotic, Mom. Just like any other medication, antibiotics can cause side effects. So my question to the audience is, if antibiotics aren't really needed for your specific ailment, and yet you demand your doctor give you one, is it really worth dealing with the unnecessary side effects that you have, ultimately, that you brought upon yourself? The CDC states that some of the common side effects of antibiotics include rash, nausea, vomiting, diarrhea, and one of the more serious side effects, C. difficile, or more commonly known as C. diff. The CDC defines C. diff as an infection that causes severe diarrhea that can lead to severe colon damage and death. And pictured is a side effect of an antibiotic resulting in a rash, because I didn't think you wanted to see diarrhea or vomit. Now that we've talked about when you should and shouldn't take antibiotics and the viral side effects that come along with antibiotic therapy, I would now like to discuss a few of the superbugs that are paving the road to destruction for future generations. According to an article on Mayo Clinic website, it states that a superbug is a term that describes strains of bacteria that are resistant to the majority of antibiotics that are commonly used today. Some of the most common superbugs include, but are not limited to today, are methicillin-resistant Staphylococcus aureus, also known as MRSA. According to medicinenet.com, MRSA may cause infection in almost any part or organ system in the body. And that is what is pictured here in a diabetic foot ulcer. Next is vancomycin-resistant Enterococcus, also known as VRE. According to medicinenet.com, VRE causes infection when it invades the bloodstream or spreads locally. It can also be directly introduced into a wound. MedicineNet.com also states that there are only a few antibiotics that can cure this bacterial infection. Next, we have carbapenem-resistant Enterobacteriaceae, also known as CRE. According to the Mayo Clinic website, CRE is a bacteria resistant to the carbapenem-classified antibiotics, which is a type of antibiotic that treats severe infections. Mayo Clinic also states that CRE superbugs have the ability to spread and share their antibiotic-resistant qualities with healthy bacteria in your body. And lastly, I'll discuss extended spectrum beta-lactamase, also known as ESBL. ESBL has the ability to break down commonly used antibiotics such as the penicillins and the cephalosporins, rendering them ineffective. The health.gov website also states that this type of superbug is most commonly spread via unwashed hands of healthcare workers. Now that we have discussed when you should and shouldn't take antibiotics and the aggressive bacteria that is raging more and more each day, I would now like to discuss how we should properly take antibiotics. Now that we've, first and foremost, take as prescribed. You need to take the correct and intended dose that the doctor has ordered, take the full amount that was prescribed to you, and if the medication states to take with food or water, you should. How not to use antibiotics. Do not misuse them. Do not stop taking when you start to feel better. The antibiotics are actually starting to work, which is why you're starting to feel better, and it will cause you more harm and good if you just randomly stop. So the next time you see your mom and you tell her you aren't feeling well and she offers you some antibiotics out of the cabinet, slap them out of her hands. You need to make sure that the antibiotics do not interact with other medications or types of food or drink because it could make the antibiotic ineffective. And lastly, but also extremely important, don't go to the doctor demanding antibiotic for a cold. You may think you have a sinus infection, which per the CDC, even most sinus infections, you do not need an antibiotic. Demanding your doctor to treat you is part of the reason that superbugs are becoming more and more stronger and resilient against our strongest antibiotics that we have. Now that I've covered when and when not to use antibiotics, the superbugs that are becoming more and more resilient to the market's strongest antibiotics, and how to properly use said medications, I would like to discuss as my final point of how to decrease usage of antibiotic therapy. First and foremost, hand washing. As a nurse, I can assure you that anytime you walk through a hospital, you will see signs that are reminding you to wash your hands or you to use hand sanitizer. If you would speak to any healthcare professional and you would ask them what is the most important way to stop spreading infection, they would answer with hand washing. You need to scrub your hands for at least 30 seconds, front and back. I sing Twinkle Twinkle Little Star, and in between your fingers and your fingernails. And although proper hand washing is key, and since hand sanitizer is such a nice thing to use, it is recommended that you do it after every 2 to 3 times you use hand sanitizer, you wash your hands in between after that. I also mentioned C. diff before, and hand sanitizer does not take away the germs of C. diff. To get rid of that, you have to use hot soap and water, or it will stay on your hands and you'll just keep the infection. Next, you need to cover your coughs and sneezes. Not only is it polite, but it will also prevent airborne pathogens that from spreading, because although someone may have a simple cold, you could be a carrier of a superbug, and when they would sneeze or cough, it could spread to someone who is susceptible to infection. And lastly, if you are a healthcare worker, proper personal protective equipment, or better known as PPE, from experience, I know it's uncomfortable and annoying to wear because it feels like you're spending more time applying it and taking it off, but it's not only beneficial to you, but also for the other patients that you're caring for. Even those that aren't in the healthcare field may have the flu, for instance. Wear a mask. Even though the flu is viral and antibiotics won't cure it, you can still spread the viral infection to someone who could be immunocompromised and leading them to a hospital stay, which could then potentially lead to a dangerous superbug, because hospitals are notorious for housing these superbugs. In conclusion, misuse of antibiotics is creating a scary world for our future generation. By not using antibiotics correctly, we as a whole are feeding the superbugs that are becoming stronger and more resilient to antibiotics each day. After my speech, I hope to encourage you to spread the knowledge that I've given to you to others about how important it is to know when and when not to take antibiotics, the superbugs that are taking over, how to properly take antibiotics, and how we can decrease our usage of antibiotics. By knowing these 4 points, you can help your future descendants live a longer, healthier life, knowing that superbugs are a thing of the past, because we as a society have taken antibiotic resistance by the horns and defeated that ugly monster before it was too late. Thank you.